Hi again, and this is Dr. Mirrafati from Mira Aesthetic Medical Center, continuing a series of videos for peptide weight loss injection, basically GLP-1, GIP, or semaglutide, Tirzepatide, and the next one is going to be retatrutide. So in another video, we covered that these peptide injection are just short amino acid that attaches to the cell, and it causes to certain reaction to happen, right? It basically bound to the receptors that are outside the cell and increases the glycogen storage and basically decreasing the hunger and increasing the, basically fat burning or metabolic rate to a certain degree. But more importantly, it lowers the sugar, which is the best thing that we want. It increases the sensitivity of the insulin that we do produce, and this is the best thing. And as a matter of fact, it's so funny that Tirzepatide recently on another trade name was it's being FDA approved for snoring and having obstructive pulmonary problem during the sleep. So it's approved for that as well. And that actually, as you know, when you do store, everything sort of goes up in your system, and sugar jacks up and is really not that good for you. So they actually recently been approved for snoring problem, which the dosage is a little bit different, but in this series we're just talking about weight loss. And interesting enough, if you read the literature, they're now blaming atherosclerosis, which is basically clogging of your arteries, not so much to the cholesterol. Now, I'm not saying go eat all the cholesterol you want, it's not going to affect your heart, but basically they're saying that the plaquing that you get in your arteries is also very highly dependent on that sugar spikes you get. So these peptide, weight loss peptide injection shots does help you to in essence not only normalize the spike you have in your sugar and increase the sensitivity of insulin to in the sense increase the sensitivity of insulin and lower your blood sugar. In essence, you kind of reduce the plaquing that you might get in arteries. So going back to our topic, Tirzepatide is the second generation of the peptide injection that came up. Is a combination of two peptides. So it affects on two receptors. The receptor one that semaglutide effect, which is GLP. This one basically affected GLP-1 receptor and GIP-1 receptor. So it has two mode of action. And this one was approved for weight loss versus semaglutide was still approved for diabetes. And then byproduct of it is weight loss. This one specifically is approved for weight loss. So maybe those receptors are more reactive to it and you lose more weight. But Tirzepatide, we found in our clinic, people are a little bit more reactive to it. They like the medication. Tirzepatide or retatrutide are the people that mostly they buy from our clinic and use. The dosage of Tirzepatide is, we start at 3 milligram. Again, the laboratory that we buy this in is got to be pure laboratory. Again, anybody that comes in here, they want to see the proof authentication of the purity of the drugs that we buy. We'd be more than happy to supply you the verification done by a third party. It's very, very important. If you didn't listen to my first video, I kind of explained that authentication of the purity is very important, and we have that on all of our peptide shots. So Tirzepatide, we start at 3 milligram, then we go to 6 milligram, then obviously we go to 8 milligram. But again, we just don't start people at 8 milligram because you were at this X, Y, and Z clinic and you were at 8 milligram, didn't affect you. It could be a number of factors: purity, dosage-wise, dilution. So in our clinic, we find out we always start, because remember, if you start too high, I can get you sick. You get basically nausea, diarrhea. You don't feel good. It's not a good thing, right? So I always start small, low dosage, so people can get used to it. And then you can move up little by little. That way you adjust to the medication and you don't have this rapid lowering of the sugar where you just get dizzy and nauseous. So you don't want to have that situation happening. So we always start with 3 milligram. And then after about a month and you say, hey, I'm doing okay, but can I go up to 6? We can go up to 6 milligram. Obviously, you don't need to come in for this. We do have virtual consultation where I can get on the phone with you virtually on the HIPAA regulated virtual screen. And then we'll talk about this and go over some of your past medical history. And then medication can be shipped to you. Again, to stress this again, all of our peptide has BPC 157 included as well. Again, BPC 157 and another peptide, short chain amino acid that increases muscle recovery for athletes who have muscle injury. But also what it does do when you lose weight, you don't lose your muscle tone. It's also great for your health of your digestive system health. So when you have a healthy digestive system or healthy gut, you basically lose weight by definition because your gut is healthy and you're getting rid of a lot of stuff that you don't need to observe. So when you do make a consultation, either coming in to one of our locations, we have 3 locations in Costa Mesa, Downey, and Rancho. We'd be more than to assess you if you do want to come in person, but you also could do this virtually and we can get you started. Whatever you decide to go, our clinic, any other clinic, if you're overweight, I do suggest that you get on one of these semaglutides, one of these peptide shot and start reducing your weight. It is going to be overall much healthier for you and you are going to be much more happier in the long term. Again, at the end, stay healthy, stay well, and then we see you in the next video.